Let's look at the ProTaper Universal technique. The following animation will demonstrate the instrument sequence in a calcified and moderately curved canal. As with any endodontic technique, good straight-line access to the orifices is necessary. Following access, the pulp chamber is filled brim full with either sodium hypochlorite or a lubricant, such as ProLube Root Canal Conditioner. We will focus our attention on a single canal in this animated lower molar. Let's begin the procedure by exploring the root canal space utilizing a stainless steel number 10 hand file. This instrument is gently fed into the canal using a small back and forth motion. When the handle is snug, pull and cut out of the canal. Repeat this motion and work the 10 file passively and progressively until it's a few millimeters short of the estimated working length. The 10 file gives us information regarding the cross-sectional diameter of the canal, if its handle is positioned on or off the long axis of the tooth, which indicates the appropriateness of the access, and the anatomy of the root canal system. Next, we use a number 15 hand file. This instrument follows the pathway previously established by the number 10 hand file. The 15 is used in a similar manner as the 10, carefully, delicately exploring and slightly expanding the glide path through the coronal 2/3 of the canal. Before using the ProTapers or any rotary instrument, irrigate with sodium hypochlorite. We'll start the ProTaper Universal sequence by selecting shaping file number 1, which has a purple ring on its handle. The arrow indicates a coronal ledge, which should be removed for better straight-line access. To accomplish this, employ a brushing motion with the shaping files. The S1 will passively follow the previously established glide path, moving apically to just short of the depth of the hand files which preceded it. Remove the S1, clean, and inspect the file. Shaping file 2 or S2 is then introduced. This instrument has a white ring on its handle. Work to about the same depth, employing a brushing motion to improve the access. This is accomplished when light resistance is encountered by withdrawing the instrument and cutting the dentin on the outstroke. In more difficult canals, it may require a couple of recapitulations to enlarge the coronal 2/3 of the canal. Irrigate, go back in with a number 10 hand file to break up debris, and then re-irrigate. Once we have finished our pre-enlargement procedures and have great coronal 2/3 access, then we use a pre-curved number 10 hand file to negotiate the rest of the canal and establish patency. A curved number 15 hand file follows to working length. This is also a good time to reconfirm your working length. Often you'll find that your efforts to move the canal orifice can affect your original measurements. When the canal is patent and has a confirmed working length, we then can use shaping file number 1 to length. This instrument will generally move to length easily since we have a smooth, reproducible glide path to the terminus. Always allow ProTaper Universal instruments to progress at their own pace. You should never force any rotary files. Following the use of S1, irrigate, recapitulate, and re-irrigate. Next, the S2 is reintroduced. In this animated example, the S2 instrument goes to full working length on the first pass. Again, take your time. When your working length has been reached, remove the instrument from the canal space. There is no need to spend additional time in the canal. Following its use, irrigate, recapitulate, and re-irrigate. Once the shaping instruments have the coronal 2/3 of the canal optimally prepared, the apical 1/3 can be finished. Finishing file number 1 has a yellow ring on its handle which designates that its tip diameter is equivalent to a 20 file. With the canal flooded with irrigant, carefully take the F1 to the working length. The finishing file's decreasing taper feature comes into play here, concentrating the shaping action in the apical region and minimizing coronal shaping. In this animated example, this is the appropriate size for the apical region.